Today we're going to talk about male plastic surgery, something that's not talked about very often, but in fact, men are more and more patients seeking youth and seeking ways to improve their aesthetic appearance. So Stafford, let's start with you. I know you've got a very busy practice in New York City. Tell us about your experience with your male patients.
So male patients are no different than female patients in wanting to look better and younger. So what do we have to offer them? We have the same range of procedures to offer them, but what do they come in for? They want the bags under their eyes improved. They want the extra eyelid skin reduced. They want their neck to look better. They want more hair.
Absolutely.
They want a change in their shape. There's a term called man boobs. They want those gone. They want the stomach where they get fat. Their legs don't get fat, it's their stomach that gets fat. They want liposuction done.
Absolutely.
So that's the range of things that we have to offer them.
Great. John, in your practice, what is the most common procedure that male patients are seeking?
So we see a lot of patients seeking the male chest surgery, the man boob surgery called gynecomastia, which involves liposuction and sometimes removing surgically a little bit of tissue underneath the nipple. That's probably number one in our practice. Number two is liposuction. And that's really, across the board, one of the most popular procedures that we do.
Is there one specific area outside of the chest that you frequently see as a problem in male patients?
So most of the male patients that I see will ask about the abdomen, and in men more so than women, I find that there's more fat that I can't liposuction out that's actually deep, called visceral fat, meaning fat around your organs. So there's a conversation that I have to have with those patients where I say, you'll have to lose that through diet and exercise because I can't get there with a liposuction cannula.
Stafford, one thing I was going to say, I do think that there is some difference between men and women, which you remember from your high school anatomy.
Right.
But even more than that, I think it's in terms of
I might have to beg to differ,
communicating.
but I'll let you go with that.
In terms of communication, that
Would you define that for me?
I think that's probably why nobody can understand what we're saying because we're guys, because men are terrible communicators. And so when it comes to these procedures, sometimes women communicate, what they want much better than men. So it can be difficult sometimes with men to actually figure out what they really want.
So apropos to that, though, it's sometimes the woman who asks the man to come in. They've had a good experience. They said, I've had this done. I'm sending in my husband. So they'll come in. They're saying, my wife sent me here. I don't know what she wanted me to come in for, but she said something about my eyes. So that might be the discussion. You're right.
A lot of men come into my practice with this curiosity because their wives have had something done, and it's interesting, they sort of let their wives be the guinea pig, and they watch and they see whether it's something that they think they can handle, and then they'll begin asking questions. And oftentimes it's what I frequently get is male patients who are very fit, they feel very energetic, but there's a little bit of an incongruency with the lower eyelids or the neck, or sometimes even later in life, the nose. It's something that's always been bothering them, and they're pursuing rhinoplasty. So would you say you have that same experience?
So just like I mentioned, it's the wide range. They come in for anything and everything. And I think it's our job to try to educate them and also to give them reasonable expectations about what the outcomes can be.
Absolutely. For more answers, please visit theplasticsurgerychannel.com.